It's day one of vaccinations here at Winchester Medical Center, and Valley Health is taking us inside to see how they're vaccinating thousands of employees. The box is unremarkable.
Pull it up.
But the moment is monumental. Nearly 3,000 doses of Pfizer's COVID vaccine unpacked with urgency. You had to hustle.
You had to hustle.
Julie Elrick runs the pharmacy.
The Pfizer vaccine is very, very sensitive. And so if it is exposed to room temperature for more than 3 to 5 minutes, it actually begins to thaw.
Winchester Medical Center bought these freezers last month. One for Moderna's vaccine, the other for Pfizer's, kept at negative 70 degrees Celsius. What is it like looking at vaccines in this freezer?
It's Christmas. It's like I'm really excited.
A tray is thawing in the fridge for 3 hours ahead of the first shots, and they've sent doses to their more rural sites. They'll have 6 across Virginia and West Virginia.
There's been months of work.
Dr. Jeffrey Feit leads their vaccine operation team.
It's been an extraordinary year. Our nurses and doctors have put themselves at personal risk.
Right now, close to 80 patients at Winchester are battling COVID. Their doctors and nurses fighting to save them.
And now we get to be part of the end, or the beginning of the end at least.
And it begins so quickly. The first dose in the arm of Dr. Benjamin Lewis, a pulmonologist.
Well done.
This is the most amazing illness I've seen in my 40 years of being a critical care physician, and we are totally at its mercy. This is a real chance for us to get control.
And the floodgates open, healthcare workers cycling through with glee and PPE.
Relax for me.
And now and then, the moment sinks in, as it did for Nurse Kristen Klutz. She works with new mothers and their babies. They won't be vaccinated. This is her way to keep them safe. What are you feeling?
Just hope for the world. And this is like a light at the end of the tunnel.
They've treated more than 700 COVID patients at Winchester. One of them was Robbie Dusing. He spent a week in the ICU, barely surviving heart failure.
At times it was a hopeless feeling. Certainly a lot of thoughts running through your mind. Are you going to make it out of here? Are you going to be able to do things like coach your kids in basketball again, to go to church with your family?
Now he's the nursing director for a COVID unit here, getting vaccinated on day one.
It means the world, because I think today is step one of our recovery process.
Vaccine skepticism is still widespread, and some staff here don't want it yet. Do you have a sense of where the numbers are?
Yeah, we're optimistic that we're going to get up in the 70-80% range in the next couple of weeks.
Why do you think it's not 90 or 100%?
It's new. It's new. And I'm respectful of that. I'm respectful of people who say, I don't know what the long-term risks of something are. I want to inform them and say, well, we don't know what the long-term risks of having coronavirus are.
This hospital, like so many, is facing its worst surge yet.
Everyone has a great fear of contracting the disease, yet they come in and continue to care for patients.
Dr. Glenn Bowder runs the critical care team and got his vaccine right away. What did that moment mean?
It's emotional.
Where does that emotion come from?
Being in the trenches a long time, taking care of these folks that are very, very sick, many of whom are dying.
71, in fact, have died here. And if this is the way to end it, Dr. Bowder thinks it's worth a shot. What does this day represent?
Hope. Hope that we're seeing the end of this.
In Winchester, Virginia, I'm Gabe Cohen.